been able to take since this pandemic began. It's almost exactly a year since we first heard about what we now know of as COVID-19 circulating in Wuhan in China. Within weeks, the scientists at Porton Down had sequenced the viral genome, and scientists at Oxford University's Jenner Institute received the genetic code for the new virus. And a bit like the great British code breakers before them, they set to work at lightning speed. We took the decision to back them from the start with funding and access to the NHS for clinical trials, and partnered with AstraZeneca, who've done a brilliant job to develop and manufacture a safe and effective vaccine at speed. I'm sure the whole House will join me in congratulating everyone involved in this huge British success story, which is not just a triumph of science and ingenuity, cracking a modern-day Enigma code, but it's in truth a victory for all, because the Oxford vaccine is affordable, it can be stored at normal fridge temperatures, and it offers hope, not just for this country, but for the whole world. Like so much else in the pandemic response, it's been a big team effort. And while this is a great British success, it's also the British way that we're at our best when we collaborate with people from around the whole world, and this is another example. The vaccines programme has shown Britain as a life sciences superpower, and the Brexit deal that this House has just passed with a very significant majority has helped us, will help us to strengthen this yet further. I want to thank the National Institute for Health Research, the UK Vaccines Network, the Vaccines Task Force, AstraZeneca, of course, and Oxford University, and all the volunteers who stepped up for science and took part in the trial, and all those who've been involved in making this happen. From the beginning, we've focused on the vaccine as a way out of this pandemic, and now it is a reality. We need to vaccinate as quickly as supply allows, following the necessary safety checks, of course, and the NHS stands ready to accelerate deployment at scale from Monday, the 4th of January. We have a total of 100 million doses on order, which combined with the Pfizer vaccine is enough to vaccinate every adult in the UK with both doses. And we will of course vaccinate according to the JCVI priority, but today's news means that everyone who wants one can get a vaccine. We already have 530,000 doses available to the UK from Monday, with millions due from AstraZeneca by the beginning of February. Mr. Speaker, the clinical advice is that the Oxford vaccine is best deployed as 2 doses up to 12 weeks apart. And the great news is people get protection after the first dose. This means we can accelerate the speed at which we can vaccinate people for the first 12 weeks before we return to deliver the second doses for that longer-term protection. It brings forward the day on which we can lift the restrictions that no one in this House wants to see any longer than are absolutely necessary. Yeah. But, Mr. Speaker, we must act to suppress the virus now. Not least because the new variant makes the time between now and then even more difficult. And so, whilst we have the good news of the vaccine today, we also have to take some difficult decisions. The NHS is under very significant pressure. There are over 21,000 people in hospital with coronavirus right now, and we can see the impact that this is having. The threat to life from this virus is real, and the pressures on the NHS are real too. I want to put on the record my thanks to all those working right now in the NHS, and in particular those, including our Chief Medical Officer, who've been working selflessly on the wards over Christmas. They deserve our thanks and gratitude and support, and we owe it to them to fulfil our responsibility to keep the virus under control. Sharply rising cases and the hospitalisations that follow demonstrate the need to act where the virus is spreading. And you'll have seen, Mr. Speaker, that yesterday alone, 53,135 new cases were registered, the majority of which are believed to be the new variant. Unfortunately, this new variant is now spreading across most of England, and cases are doubling fast. It is therefore necessary to apply Tier 4 measures to a wider area, including the remaining parts of the South East, as well as large parts of the Midlands, the North West, the North East and the South West. And I've laid a comprehensive list in the Library of the House and published on gov.uk. Even in most areas not moving into Tier 4, cases are rising too, and it's therefore necessary to apply Tier 3 measures more broadly too, including in Liverpool and North Yorkshire. The rest of Yorkshire remains in Tier 3. These changes will take effect from 1 minute past midnight tomorrow morning. The new variant means that 3/4 of the population are now going to be in Tier 4, and almost all of the country in Tiers 3 and 4. And I know that Tiers 3 and 4 measures place a significant burden on people, and especially on businesses affected. But I'm afraid it's absolutely necessary because of the number of cases that we've seen. But where we're still able to give places greater freedoms, we will continue to do so. Mr. Speaker, today is a day really of mixed emotions. The joy that we have in the vaccine giving us a route out of this pandemic, the pride that Britain is the first country in the world once again to approve this British vaccine, the sorrow at the deaths and the suffering that the virus has caused, and of determination that we must all stick at it during the difficult winter weeks ahead. We end 2020 still with great challenges, but also with great hope and confidence that in 2021 we have a brighter future ahead. And I commend this statement to the House.
We now come to the Shadow Secretary of State, Jonathan Ashworth.
Thank you, Mr. Speaker, and as always, I thank the Secretary of State for advance sight of his statement, and I totally understand why he's had to come to the House this afternoon to move further areas into Tiers 3 and 4. I mean, we are, as he says, almost the whole of England is now in a form of lockdown, and for my constituents in Leicester, and I'm sure the constituents of honourable members from Greater Manchester will be deeply worried that our areas have now been in a form of restrictions for months and months and months. It's having a huge impact on families and small businesses in cities like Leicester, and I'm sure for areas in Greater Manchester as well. He's also moved Liverpool into Tier 3. Liverpool was the great success story, so is it his view now that the mass lateral flow testing is not enough to contain the spread of this virus? And our constituents will be asking how long he expects these lockdowns to be in place. We will vote for the regulations tonight because the situation we are in is truly horrific. As he has outlined, the virus is out of control. Yesterday, over 47,000 cases reported in England. In the last 2 weeks, nearly 500,000 cases reported. In England, there are now more patients in hospital, over 20,000, than at any time in this pandemic, with admissions rising day by day, including almost 2,000 on Christmas Day. Hospitals are close to or at surge capacity. We see ambulances queuing up outside hospitals because there are not enough beds for patients. We have London hospitals requesting to transfer patients in need of intensive care to Yorkshire. Frontline healthcare workers warn of oxygen supplies running low. So can he assure us there will be no disruption in oxygen supplies through this second wave? Our NHS staff are exhausted, morale is low, staff absence is said to be double its normal level, leave for many is cancelled. And this time there is no evening applause on our streets, just long, dark, hard nights for our NHS staff. The Nightingales were opened at great expense and fanfare, but now we hear that some of them, such as London's, have been emptied. Will they be used? And if so, given the staff shortages we know that there are across the NHS, how will they be staffed? There are reports today that only 1 in 8 retired NHS staff, just 5,000 out of an eligible 30,000 who applied, have been brought back to help. Shouldn't we be making full use of this resource, especially to help with vaccination? Today's AstraZeneca news is indeed a tremendous boost, and I congratulate all involved. But can he confirm how many doses we currently have today ready to go? Because we are in a crisis now. Mass vaccination needs to start straight away. We need to go hell for leather to get these jabs rolled out with no delay. We've already lost more than 600 healthcare workers to this horrific virus, including a disproportionate number of black, Asian, minority ethnic staff. Frontline NHS staff need the protection of the vaccine ASAP. Will he set a clear target for when all NHS frontline staff will receive the life-saving jab? And can he tell us when all care home residents and staff will be vaccinated? And he will recall that I raised with him the situation facing those with terminal illness. Can he clarify what the JCVI's guidance is for that group today? This is a race against time, because the more the virus circulates, the the more opportunities it has for further variants to emerge. The new B117 variant is 56% more transmissible. It's the dominant strain in London, the South East and the East of England. The nerve tag minutes from 18th of December suggest it could add at least 0.4 to the R. Given the first lockdown brought R to about 0.6 and the second lockdown to about 0.8, this surely means it will be harder to bring infections under control, and so harder measures will be needed. So will he publish in real time the advice he is receiving from SAGE on the restrictions needed? This is a global crisis, but let us be clear, this is a national emergency. Our National Health Service is becoming overwhelmed. I hope the Tier 4 restrictions are enough, but many believe even tougher restrictions are now inevitable. Does he agree? We need not put more lives in jeopardy when vaccines are so near. Let's give the achievements of our scientists the best chance to save lives. The country has sacrificed so much in 2020. Let's not repeat the same mistakes. We must start 2021 by doing everything it takes right now to save lives and support our NHS. Only then can we look forward with confidence and hope.
Secretary of State.
Thank you very much, Mr. Speaker. Well, he's quite right that there are problems with the challenges thrown up by this virus right around the world, and we're seeing some of the news from other parts of Europe today in terms of the impact in other countries. But he's also right that thanks to the approval of this vaccine, alongside the Pfizer-BioNTech vaccine, the end is in sight. And that should give us hope that whilst we have difficult weeks ahead of us, we also can see the route out of this pandemic and to normal life returning with all that means and entails. He talked about the pressures on the NHS, and there are significant pressures on the NHS. One of the advantages of having a national health system is that when one area of the country faces particular challenges, then others can come to its mutual aid. And this is in process, it is happening, and it does mean that people are sometimes being taken across the country to receive care where there is spare capacity. That is necessary, and that is how the system works when it's under significant pressure. He asked about the vaccination of NHS staff, and I can confirm that thanks to the decision today announced by the regulator, we will be able to accelerate the vaccination of NHS staff who are already in priority group 2, as well as, of course, the over 80s and the care home residents and staff. He asked about the number of vaccines we have available, Mr. Speaker, which I mentioned in the statement. We have 530,000 across the UK that are available for deployment in the first week of January, and the NHS is doing a fantastic job of constantly increasing and expanding the scale of its operation. And finally, he asked about what more could be done in the areas where rates are very high and continuing to rise. And the true answer to that, Mr. Speaker, is that it is on all of us, and it's about how everybody behaves. Because if we collectively decide to stop this by taking personal responsibility and not coming into contact with others unless it's absolutely necessary, that is how we can slow the spread of this virus within, of course, the tiers restrictions which are necessary, but ultimately it's about how we all behave. That's how we're going to get through the next few weeks together, and then the vaccine can come and save us.
Let's head to Surrey with the Chair of the Select Committee, Jeremy Hunt. Jeremy.
Thank you, Mr. Speaker. The news from AstraZeneca is fantastic, and he and indeed British science in general deserves enormous credit. But the NHS now is busier than it was last April. In parts of London, it looks like it may fall over. But back in April, schools were shut. Next week, primary schools are due to reopen. In September, we came to regret allowing university students to go back en masse, but some universities are going to start to go back from next week. Why, in the middle of winter, when the NHS is under such pressure, when we have a dangerous new strain of the virus, are we taking such huge risks? Shouldn't our entire focus for the next 8 to 12 weeks beyond saving lives, getting the first dose of the vaccine out to every single vulnerable person, stopping the NHS collapsing, and putting NHS frontline staff at the front of the queue for the vaccines so that we keep safe the people upon whom our safety depends.
Just before you do, can I just remind members who are not in the chamber that they should have the same dress code, even though they are virtual. It is only fair that we treat each other with the same respect. Secretary of State.
Thank you very much, Mr. Speaker. Well, I share my right honourable friend's desire and strategy of keeping this virus suppressed whilst we get the vaccine rolled out as fast as possible. And one of the other good pieces of news from this morning's announcement is that we can roll this vaccine out faster because we only need to give the second dose after 12 weeks. It means we can get the vaccine into more people, the first dose, which the data shows gives that immunity, which means that we can get through the protection of the nation faster than we previously could have done. On the points he raises about education, of course these are important points. The Education Secretary is setting out in a statement shortly the details of how we're going to manage the very difficult balance between needing to keep children in education as much as possible whilst also ensuring that we don't add upward pressure on the R and we don't spread the virus any further. I commend to him the Education Secretary's statement.
Let's head up to Scotland with the SNP spokesperson, Dr. Philippa Whitford. Dr. Whitford.
Thank you very much, Mr. Speaker. As chair of the all-party group on vaccination, I absolutely welcome authorisation of the AstraZeneca vaccine. Storage in normal fridges will make it much easier to deliver here, but particularly in low and middle income countries, which would have struggled to maintain the cold chain at minus 70 degrees as required for the Pfizer vaccine. But delivering the vaccine will still be a Herculean task for all 4 UK health services, and they will struggle if they are also dealing with surging COVID cases. Hospitals in London and the South East are already reporting shortages of critical care beds and even oxygen. So there's an urgent need to get the new variant under control. Does the Secretary of State recognise that when dealing with a spreading infection, getting ahead of it is critical? Only taking action once cases in an area are soaring is simply too late to bring it under control. All 3 devolved nations are already under level 4 restrictions to try and prevent the new variant getting a grip and getting out of control. So with greater levels of the new variant in England, and as he just stated, cases rising everywhere, does the Secretary of State not think it's also time to put the whole of England under tightened Tier 4 restrictions?
Secretary of State.
Thank you very much, Madam Deputy Speaker. Well, I have just announced the need to move a significant proportion of England into Tier 4 restrictions, and I welcome the implicit support for that measure, but also where it is possible to keep some of the freedoms that we all cherish, then I think we should. And that's the basis of the tiered approach that we're taking. I, of course, welcome her support for the rollout of the Oxford AstraZeneca vaccine. This will happen right across the UK from Monday, and it's been a pleasure working with Jean Freeman, the SNP government's health spokesman, cabinet secretary in Edinburgh, in Holyrood, to make sure that this vaccine that has been bought and developed and supported so effectively by UK science and right across the country that it can be deployed properly to everybody in the whole UK on a fair and equitable basis according to their clinical need. I'm looking forward to working very hard to make sure that happens.
Let's head to Stroud with Siobhan Bailey. Siobhan Bailey.
Thank you, Mr. Speaker. There will be many businesses in Gloucestershire that are gutted to be placed in Tier 4, and it makes the rollout of the vaccine even more important. But there is a worrying increase of anti-vax information in Stroud. It's causing a lot of distress and upset for local people, and it's appalling that our Gloucestershire Hospital Trust had to spend their precious time during this pandemic defending themselves against films on social media that were wrongly claiming the hospital is empty. Will the Secretary of State assist me to reassure Stroud about the vaccines and encourage people not to share COVID information from unofficial sources to stop this dangerous, damaging and disrespectful behaviour?
Yes, Mr. Speaker, I strongly agree with my honourable friend who speaks very powerfully about the need for the proper authorised information about these vaccines which save lives. And we've been very careful to ensure that the independent regulator makes the decision on how these vaccines should be deployed, indeed whether they should be deployed, and they are confident in their safety and their efficacy. And it is that information and all of the information that is set out by the NHS that people should look to if they've got questions, if they want to know how and why the vaccine works, and who it should be used for. And I pay tribute to all those who work in the hospitals of Gloucestershire. It is hard work at the moment in the NHS. Rates of coronavirus in Gloucestershire over the last just 2 or 3 weeks have really shot up. And unfortunately, that's why we've had to take the action that we have on restrictions. But I want to thank all of the NHS for doing all the work that they have been doing over Christmas and will have to do over the weeks ahead.
Let's head to Twickenham with Munira Wilson. Munira Wilson.
Thank you very much, Mr. Speaker. And can I also start by welcoming the fantastic news about the Oxford AstraZeneca vaccine and congratulate all those involved. Mr. Speaker, I found it frankly shocking that the Secretary of State's statement made barely any reference to the immense pressures our hospitals are facing on the ground and what the plan is to help them with this situation. Major incidents have been declared in Essex and London. Ambulances are queuing outside hospitals. ICU patients are being transferred across country. The Nightingale hospitals were meant to be the insurance policy, but we hear that only 28 COVID patients are in the Nightingale hospitals across England. So if now is not the time to use the Nightingales, when is? And if there are insufficient staff, why on earth did the Secretary of State spend £220 million building Nightingales? What is the backup plan?
Thank you very much, Mr. Speaker. I'm not sure that the Honourable Lady was listening when I said in my statement that the NHS is under very significant pressure. And of course, we're working hard to ensure that that pressure is alleviated as much as possible. Over the summer, we have built significant extra capacity into the critical care facilities of the NHS, including across London. Of course, the Nightingale hospitals are there, as she puts it, as an insurance policy. They're there as backup. The London Nightingale Hospital is there on standby as backup. I've seen some stories circulating saying it's been decommissioned. Those stories are wrong. But it is better for people if they're treated inside a hospital. But of course, the Nightingales are there for extra support should it be needed. And this will require changes to working patterns of staff if we do need to if we do need to have patients in the Nightingales once more. But it is crucial, in my view, that we have those Nightingales there, ready, in case we need them.
Thank you, Mr. Speaker. I can confirm to my right honourable friend that Essex has declared a major incident, and can I also inform him that at this very moment they are submitting a request for military assistance to the civil authority, a MACA request, to assist with the construction of community hospitals, additional hospital capacity, and supported by the armed forces and partly staffed by the armed forces. They would also like armed forces help with the rollout of the vaccine, to accelerate that in Essex, and to assist with testing in schools. And could I ask him to look into the German BioNTech test as an alternative to the lateral flow